Do you know that liver cancer is more common in people with pre-existing liver disease? Hi, this is Dr. Nikhil Agarwal. I am Director of Gastrointestinal Oncology at Max Super Speciality Hospital, Saket. In my years of practice, I come across many questions related to liver cancer. Today, I'll try and answer some of these questions and also clear some misconceptions about liver cancer. One of the common questions asked is, how do I know if I have liver cancer? Liver cancer usually occurs in patients with pre-existing liver disease such as cirrhosis. In these patients, we screen them regularly for liver cancer. We do tests which will detect liver cancer at an early stage. These tests are blood tests and they are imaging tests such as ultrasound, CT and MRI. The idea is to detect liver cancer at a stage where it can be treated and we can get good outcome. In people who doesn't have liver cirrhosis, they should watch for symptoms of liver cancer such as pain abdomen, bloating, abdominal distension, jaundice, loss of weight and loss of appetite. If you have any of these symptoms, then you should consult your doctor and get investigated. Another common question often asked is, how do I prevent liver cancer? To prevent liver cancer, we have to maintain certain healthy habits and we have to get treated for certain diseases. We should get vaccinated for hepatitis B. If somebody is suffering from hepatitis, he should get treated for it. Apart from that, if somebody is smoking or drinking, they should quit doing that because that damages liver and makes us prone to liver cancer. And we should also maintain a healthy lifestyle, which includes eating a healthy diet which is rich in fibers, fruits and vegetables, and regularly exercising. Apart from that, we should also maintain a healthy weight. By doing all these things, we can lower our risk of liver cancer. Another question I get asked is, does fatty liver cause cancer? Fatty liver is a common term we use to denote two medical conditions which are non-alcoholic fatty liver disease, that is NAFLD, and NASH, non-alcoholic steatohepatitis. They are on a spectrum from NAFLD to NASH. NAFLD per se is not associated with cancer. So if you have only fatty liver disease, non-alcoholic fatty liver disease, it doesn't cause cancer. But once there is inflammation in the liver because of NAFLD, then it is associated with cancer. It causes cirrhosis as well as cancer. So fatty liver disease is a spectrum. NAFLD doesn't cause cancer directly, but NASH is associated with cancer. Another common question is, how is liver cancer treated differently? So when we talk about liver cancer, there are two components to liver cancer. One, we know that the liver cancer occurs in pre-existing livers which are bad. So patients with cirrhosis, they get liver cancer. So their liver is bad and they get cancer. So there are two components to treatment, liver and cancer. So we have to see how bad is the cancer, how bad is the liver, because we cannot do aggressive treatments in liver which are bad, and we cannot also do aggressive treatments in bad cancers. So there are three broad categories of treatment which we can do. One is surgery. Surgery includes resection, in which we remove the part of liver which is affected. Two, we can do transplantation. Other treatments are local treatment, in which we treat the tumor locally. We go and deliver some treatment only to the tumor. Right? So this will include ablative treatments like radiofrequency ablation, microwave ablation, radiation, and then there are modalities in which we go inside the blood vessels supplying the tumor, and then we deliver some chemotherapeutic agents or radiotherapeutic agents and we block the artery supplying the tumor. Right? So these are called as TARE and TACE, transarterial radioembolization and transarterial chemoembolization. Now sometimes we don't find cancer in a stage where it can be treated with these modalities, or even it can be treated with these modalities, we have to add certain treatments which are called as systemic treatment. Systemic treatment acts on the whole body and the tumor. So these are targeted treatment and immunotherapy. See, there is a lot of development going in this area and multiple newer agents are coming up. So this is how we treat liver cancer differently from other cancers. So friends, today we answered some common questions about liver cancer. We know liver cancer was and used to be a lethal cancer. However, now we have many treatment options available, which include surgery, transplantation, local treatment, and systemic treatment such as targeted treatment and immunotherapy. But the best thing is to prevent or reduce our risk of getting any cancer, including liver cancer, and this can be done by doing few things such as adopting a healthy lifestyle, quitting bad habits, and getting treated and vaccinated for hepatitis. Thank you. Stay safe, stay healthy.